This building is a 54-bed mental health inpatient hospital. It's the re-provision of the Department of Psychiatry in Eastbourne. It's providing for the community a quiet and calm space, and the building design is focused around a therapeutic environment and access to therapeutic facilities that is a step change for the Department of Psychiatry.
We are currently at a site over in Eastbourne, the Department of Psychiatry, on a very busy acute site. And we were tasked centrally to eradicate dormitories. We needed to find somewhere in the longer term where we could actually create a facility where all our patient-facing bedrooms are on the ground floor, because at the Department of Psychiatry it's on 2 floors, and that we can actually create garden space, both internal courtyards and external space, where in terms of recuperation and recovery is going to be a lot better.
So an expert by experience, an EBE, is someone who uses their lived experience. So I have lived experience of mental health conditions and also physical health conditions, and I'm neurodiverse. What it means is that I use this experience in different ways. I've been a critical friend, ensuring that kind of different things go to plan, and when different projects kind of come in. So for example, like interior design. This new hospital looked kind of quite shiny, exciting. It looked really quite airy. I wanted to get involved, to have my kind of say, to see how different people could have a different experience.
I think people are going to be really excited by the new hospital. It's very spacious, there's lots of light, it looks really professional, lots of spaces for the patients, for socialising with other patients, for meeting family, just relaxing on their own. It's going to be a big improvement over the current Department of Psychiatry.
We started to then look to see whether we could find a construction partner which would really help and work with us and support us right through the construction stage. And we wanted someone who not only has the track record of delivery of healthcare facilities, but really understand what we're trying to achieve through this new building.
The building itself is going to provide a vastly improved therapeutic environment for not only the service users, but also the estates and facilities staff, as well as the therapists and all the variety of NHS staff that will end up working in this building.
We're currently supporting people that we care for in dormitories, and the space, the social space, isn't what we would like. I'm really looking forward to the team being able to transfer over to the new hospital and to be able to offer the people that we care for a place that provides excellent services. Working in the Department of Psychiatry was the first ward that I worked on as a staff nurse. So it's really exciting for me to see, after many years of planning for a new hospital, for it to actually come to fruition as I'm approaching the end of my career after almost 40 years. So I'm really excited about that.
It has the potential to be like a medical centre. So potentially I could see myself like studying there or working there in the future. It's a really special place.